Welcome. My name is Lisa Diamond. I'm a professor of psychology and gender studies at the University of Utah. And I'm going to be talking today about women's sexual development and sexual functioning, a lifespan perspective that will specifically be talking about some of the implications of childhood and adolescent gender socialization on issues for women's sexual functioning over the lifespan. So, to provide an overview, I'll be talking about different types of influences on gender socialization, on girls' sexual development, their implications on adolescent girls' sexual development and behavior, and their implications and their links to later life sexual experience and sexual functioning. So I'm going to start with a quote from former Surgeon General David Satcher, who had a really progressive notion of sexual health that I think is important to consider in this context. He said, sexual health includes the abilities to develop and maintain meaningful interpersonal relationships, to appreciate one's own body, to interact with both genders in respectful and appropriate ways, and to express affection, love, and intimacy in ways consistent with one's own values. And he went on to say it includes freedom from sexual abuse and discrimination, and the ability of individuals to integrate their sexuality into their lives, derive pleasure from it, and to reproduce if they so choose. He said adolescents need education, skills, training, self-esteem, promoting experiences, and appropriate services related to sexuality, along with positive expectations and sound preparation for their future roles as partners in committed relationships and as parents. And I think that we can all see that that's a really positive and empowering vision of sexual development, but unfortunately it really is not the type of developmental environment that children and adolescents encounter with regard to sexuality, and this is especially true for girls. And here's a quote from Michelle Fine that really describes, I think, the type of climate that most girls face. She said, the adolescent female rarely reflects simply on sexuality. Her sense of sexuality is informed by peers, culture, religion, violence, history, passion, authority, rebellion, body, past and future, and gender and racial relations of power. The adolescent woman herself assumes a dual consciousness, at once taken with the excitement of actual or anticipated sexuality and consumed with anxiety and worry. And these messages that girls receive about their sexuality begin at a very early age. We don't tend to think about children experiencing sexual desire, but they do. We know that children begin exploring their bodies and exploring other kids' bodies at very early ages, which often frightens parents, but is really nothing to be worried about. But most of the negative messages that children begin to receive intensify around puberty. We know that sex drive increases markedly during puberty for both boys and girls. But we send very different messages to boys and girls about these changes. Boys get the message that this is normal, and they talk about raging hormones and boys being out of control. Girls don't get those messages. And that's why I asked, have you ever seen a teen movie where girls are portrayed as sex-crazed or looking for action? We routinely present boys as sort of obsessed with getting their sexual needs met. We don't portray girls in that same way. And so girls get the message that they're just not as sexual. They're not supposed to want sex as much as boys. Instead, their job is to say no. Their job is to be the gatekeeper, preventing sexual activity. And these messages not only deny girls natural sexual desires, but they encourage girls to distance themselves from what they are experiencing, to not acknowledge and express their desires, to not pay attention to the messages that their bodies are giving them, and to really distance themselves from their bodies and from their experiences. And a feminist, Dana Loke, said in 1997, this process of splitting self from body began for all women through socialization in their early years and reached a crucible at puberty. And that's really the process that we're talking about. Jane Usher said, the significant messages contained in the media warn the young woman to be afraid of her body because it can let her down by becoming fat, emitting unpleasant odors and bleeding. At the same time, she receives the message that her body is her passport to happiness. It is through her body that she entices a man, which should be her main objective. And finally, Heck said in 1999, while I knew the size of my breasts down to the last centimeter, because they at least were getting talked about, I had no idea what a clitoris looked like, let alone what one was. Right? So the messages we give girls really emphasize their attractiveness to men, but not their own capacity for pleasure. And a lot of studies that have looked at sort of the media and educational messages that boys and girls receive about their sexuality in the adolescent years have shown that for adolescent boys, messages about sexuality really begin to revolve around sexual entitlement and power, and also sort of claiming a certain status and maturity. But for girls, the messages around sexuality revolve around accommodation and protection, right? A boyfriend is supposed to protect you, and the sexual access that you give to that boy is sort of a transaction between their protection and your accommodation and submission. So even when girls do experience strong sexual desires, they're given the message that they're not supposed to be the one to initiate it. They're supposed to wait for the other person to initiate sexual activity with them and to sweep them away and sweep them off their feet. And this is known to be one of the reasons that adolescent girls tend to not plan for sexual activity with birth control or condoms, because if you plan for sexual activity, then you're responsible for it. Then you're more of a slut. If you don't plan for it, then you have the explanation that you were swept away, that it happened without planning. And that's a more acceptable position for girls to take in this culture. Girls also have really complicated relationships with their genitals. Adolescent boys report much more positive feelings about their genitals than girls do. They also report much more explicit awareness of them and awareness of their own experiences of sexual desire. And I think that makes a lot of sense. The external nature of boys' genitals makes it easier for boys to develop some comfort looking at them, touching them, and associating them with pleasure. When boys become aroused, they can see it. They can sort of link up the psychological experience of desire with the physiological response to desire very easily. For girls, that's much different. Many girls never look at their genitals. Tend to feel embarrassed about them, and they tend to not be very aware of the physiological signs of arousal, such as vasocongestion, an increase in the size of the clitoris, an increase in vaginal wetness. Unless they are comfortable exploring their genitals with their hands, they may not be aware of those changes. And we do know from physiological studies that there's a greater discordance between women's genital responses to sexual stimuli and their psychological responses to sexual stimuli than is the case for boys and men. And so there's a disassociation between the psychological experience of arousal and the physiological experience of arousal that develops in girls that I think has to do with these early developmental experiences where they're not as comfortable exploring their genitals. Masturbation is also commonly assumed to be a male activity. Boys hear messages about masturbation all the time. It's the subject of many jokes. They become, if not a little, fully comfortable, they become more comfortable talking about it than girls do. Girls tend to receive the message from culture that masturbation is a boy thing. And so girls that do masturbate often feel much more shame about it. They're less likely to talk about it with their peers. And so again, you have a general discomfort with the genitals and an unfamiliarity with what it is that feels good and doesn't feel good. And that's a very different case than for boys. Pleasure is something that we don't spend a lot of time talking to adolescents about. Most of the adolescent literature on sexuality, both the lay literature in terms of sort of educational messages given to boys and girls, and also the academic literature, focuses much more on the dangers of sexuality than the pleasure associated with sexuality. You wouldn't even know that pleasure was involved from some of this literature. You know, adolescents can be forgiven for thinking to themselves, if sex is so dangerous and dirty and scary, why does anybody do it? Right? They don't get the message that this is an intensely pleasurable and wonderful experience that their bodies can give them. When girls' motives for sexual activity are discussed, they're often reduced to things like popularity, that, oh, they're going to give in to a boy's pressure in order to get that boy to be her boyfriend, or to be popular, or to seem adult, as if girls were not motivated to have sex because they have sexual urges, right? We suggest to girls and boys that it's the boys that have sexual urges for sexual activity, and girls' urges are really social, you know, popularity and pressure. And when adults talk to girls about sexuality, they tend to emphasize the risks for pregnancy, the risk for sexually transmitted infections. They don't tend to talk to girls about desire and pleasure and masturbation and orgasm. We also know that very little research has focused on how both boys and girls experience the subjective quality of some of their early sexual experiences, and not just coitus, but oral sex, manual stimulation. There's a whole host of non-coital activities that youths tend to begin experimenting with before they engage in coitus, and we don't tend to study the motives and meanings that youth attach to those experiences, and the pleasure or lack of pleasure that they associate with those experiences. Girls are more likely than boys to describe their sexual experiences as disappointing, especially their coital experiences. Many girls report that they actually find foreplay a lot more satisfying than coitus, which is something that adult women often say as well. But because we tend to give the message to boys and girls that it's coitus that is the goal, girls don't generally tend to feel empowered to ask for more foreplay. We also know that many girls report that a lot of their sexual experiences as adolescents, especially some of their earliest sexual experiences, are unwanted but not coerced. In other words, no one forced them to do it, but they didn't really want to, so they just went along. And this has received increasing attention in recent years, and we know that it also happens quite a lot among college women. And when girls are asked why they would engage in sexual activity that they didn't want to, they'll say that, well, if you're dating someone, it's sort of part of the contract. You just kind of go along with it. It's not fair to be in an ongoing relationship with someone and say no to sexual activity. So again, the messages that we give to girls about their own entitlement to sexual pleasure are not very empowering, and tend to put them in positions where they're likely to have a lot of unsatisfying sex. We also know that sexual coercion and abuse are huge problems. One recent survey found that 11% of women report at least one experience of forced sex, and the most common age is the adolescent years, between 12 and 17. And coercion is not just physical coercion. It typically begins with psychological manipulation and bullying, making girls feel guilty if they don't engage in sexual behavior. And we know that there are negative mental health consequences for all forms of coercion, and we know that these experiences can establish negative expectations about their future sexual experiences and their future expectations for sexual pleasure. So overall, we place a lot of burdens on girls. We communicate that sex is a dangerous activity that carries risks for pregnancy and disease and abuse. But instead of talking about those risks as managed between boys and girls, we tend to place most of the burden on girls to avoid them by saying no to desire, by keeping their legs closed, by, pushing off attempts to gain access to them sexually. And even with sexual assault, we tend to still communicate that sexually active girls are partly responsible for assault experiences. The implications of this for sexual functioning in the future, I think, are pretty dire when we acknowledge that the number one form of female sexual dysfunction is hypoactive sexual desire disorder, a lack of motivation for sexual activity, low levels of spontaneous sexual desire, and a lack of responsiveness to sexual cues. We know that hypoactive sexual desire disorder increases with age, but we also know that the rates are quite high for younger women. It's definitely not a postmenopausal phenomenon. It's also not always linked to hormonal factors such as declines in estrogen. We also know that there are a lot of psychological correlates: low self-worth, impaired body image, feelings of incompetence, poor feelings of connection with sexual partners. And one of the things that we're coming to realize is the degree to which these are really dyadic phenomena. The treatment approaches to hypoactive sexual desire disorder in the early days really focused on what was wrong with the woman with low sexual desire. There is an increasing awareness of the fact that this is really a dyadic problem. For example, if the issue is that one partner wants sex more than the other, why is it that the low desire partner is wrong? Why isn't it the high desire partner that we consider to have some sort of a problem? So that has gotten a little bit more flexible, a little bit more sophisticated, but I think we have not paid enough attention to the developmental implications of female socialization on sexual desire problems. Given that we teach girls for the first few decades of their lives that their job is to dismiss and deny their sexual urges, to keep their legs closed, to notice all of the flaws in their bodies and not any of their experiences of pleasure, well, we shouldn't be surprised when they develop these problems later on. After that much socialization that teaches you not to pay attention to your sexual desire, how can we suddenly expect adult women to turn on sexual desire like a faucet once they are in the right socially approved place to have sexual activity as an adult in a long-term committed relationship with the right partner? It just doesn't work that way. I think that when we're talking about these sexual desire problems, we need to go beyond just the sensitive treatment approaches that take the dyad into context and that focus on some of these emotional predictors. I think instead we need to pay greater attention to the culture that gives rise to these problems, and we need to take a cultural approach to preventing female sexual dysfunction. This would really require large-scale systemic changes in how parents, educators, and pediatricians talk to girls about sexual desire, about sexual experimentation, about masturbation, about pleasure. We also need to encourage clinicians to talk to women openly about the messages that they received about sexuality during their own childhood and adolescence. What did they learn about pleasure? Did they masturbate? Did their parents discourage it? What messages did they receive about responsibility, about blame for sexual assault, about shame, about danger? We need to be more aware that repression is pretty much a cultural norm for all women when it comes to sexuality, but it certainly may be greater in some communities and in some families than others. And that's a critical part of a woman's sexual history that we need to take account of. We also need to encourage pediatricians to talk openly to parents about girls' masturbation and sex play and to normalize those experiences and make sure that they're not giving stigmatizing messages and that parents are aware that these are normal activities, nothing to be concerned about, and that as long as girls have privacy, there's no reason to discourage these activities. I think we should also communicate to parents that they need to take an active role in communicating to their girls that their body does have a powerful capacity for pleasure, and that capacity is a wonderful gift that belongs to them. So instead of saying, boys are going to try and get into your pants and you need to keep them out, we could say instead, your body can give you so much pleasure, and that is a wonderful thing. And you know what? That is yours. And you get to decide who you share that capacity with. It is yours and yours alone, and something to be cherished and celebrated, but that you have ultimate control over that. I also think we need to encourage parents and health educators to give similar messages to boys and girls about sex, to communicate to both of them that sexual desires are strong and that you have the right to say no. We know that some boys engage in unwanted sexual activity as well because they feel like they need to gain social status. So we could do a better job at communicating to both boys and girls that both of them have strong sexual desires and that both of them have the right to control what they do with their capacity for pleasure and sexual activity. We need to do more talking about pleasure in general. Instead of just talking about the risks of sexual activity and being worried about when they begin engaging in sexual activity, we should talk about the nuts and bolts of what's actually happening, about how the penis is stimulated, how the clitoris is stimulated, and normalizing the idea for girls that they have the right to experience just as much pleasure during penile-vaginal penetration as boys typically do. We tend to have this attitude in society that girls are supposed to reach orgasm during vaginal penetration without any sort of direct stimulation of the clitoris, even though we know that in 70% of the cases, women need direct stimulation of the clitoris in order to reach orgasm during vaginal penetration. We should begin talking about this in adolescence. Most boys and girls see plenty of movies and TV shows where it looks like every single episode of penile vaginal penetration is just wonderful for both the woman and the man involved, and you rarely see the man doing anything to manually stimulate the woman's clitoris. We need to normalize that sort of encounter for girls and boys so that they feel that girls are entitled to sexual pleasure and that they can take control of guiding what their sexual interactions look like, and that they feel comfortable negotiating what happens during their sexual interactions. So in conclusion, I hope that we can take a lifespan approach to understanding female sexual desire and have a greater appreciation for some of the long-term implications of the cultural suppression of female sexuality that still is normative in our culture. We can sort of think about this as trying to develop culturally competent approaches to treating sexual dysfunction. We know the importance of cultural competence in a whole range of clinical realms, and I think this is one that it extends to. The cultural competence that we need to focus on here is one that acknowledges the routine suppression of female sexuality. And hopefully we can integrate these more sophisticated clinical approaches with community-based educational approaches that speak to educators and that speak to parents about the messages that they're giving to their girls about their bodies. And hopefully we can develop an approach that changes our clinical approach to female sexual functioning and also changes our society's approach so that clinical change really is social change. Thank you very much.